Hi, thanks for watching episode number 77 of the Doctor Podcast Show. And I'm your host, Dr. Robert Seiker. We'd really appreciate it if you could click on the subscribe and follow button, because that way we'll get more excellent guests like we have today. And we'd also appreciate if you click on the like and repost button so that we know you love this episode, and we're sure that you will. Today, we're talking about a topic that's very much in the news, especially in social media in the last few years, and that topic is plastic surgery. And we have a top plastic surgeon guest today, Dr. Dennis Schimpf. Dr. Schimpf is a board certified plastic surgeon. He is a fellow of the American College of Surgeons. He's also a member of the American Society of Reconstructive Microsurgery, which is a type of plastic surgery. He's also a member of the American Society for Aesthetic Plastic Surgery and has many years of experience. Uh, Dr. Schimpf practices in Charleston, South Carolina, and also in Somerville, South Carolina, in the Sweetgrass Plastic Surgery and Spa practice. He's also the author of several books about plastic surgery for the public, which we'll talk about some more. And I'll post this online. You can find more information about Dr. Schimpf at drdenisschimpf.com and also sweetgrassplasticsurgery.com. So, Dennis, thanks very much for taking time from your busy day to join us to talk about a very hot topic of plastic surgery. Tell us about your background, how you got interested in plastic surgery, and how many years of training that took to become a board certified, experienced plastic surgeon.
Well, thank you very much. It's great to be here. The years fly by, as I'm sure you can relate to. It's kind of scary when you reflect back now at this point. When years ago you thought you'd never get through it, and now you're like, where to go? What happened? But yeah, I came to medicine late. Actually, I went to college on an athletic scholarship. Was going to go to kind of something in the college atmosphere, like a counselor, and kind of work in athletics. And then for a while, I was going to go to law school, and then I volunteered in a hospital in one of the local areas there in Buffalo, New York, where I was, and had to get community service. Of course, I waited till the last minute, and the only place I could get all that to graduate was a hospital because it was open 24 hours a day. So I went in there and volunteered in an emergency room, and I just loved it. I had never taken really any science courses. I'd been a liberal arts kind of humanities, third world religion type major. And I just loved the sciences. I loved being around the hospital. And at the last minute, right about the time I was graduating, I decided to go back and do a post-bachelor in science and had to do, God, the first semester was like biology, chemistry, physics. I had to take all these things in a year and a half that I had never taken and actually got the best grades I'd ever got. So uh,
Very, very different than art appreciation courses.
Yeah, yeah, much different, much different. But actually, a lot, much harder and but much more interesting for me at the time. And so it worked out. Uh, got through that, got through school, the first 4 years of medical school, and then did general surgery 5 years first at the University of Buffalo, SUNY Buffalo. As you know, in that you're exposed to everything, and everybody changes their mind at some point.
Right.
Originally, I thought I would do something like neurosurgery I liked, and then it became more and more endovascular than open type repair. And I enjoyed trauma. So I just kind of went through everything. And plastic surgery, about my third year, really became the thing I loved, and mainly because you still operate on the whole body. It was pretty amazing, and you operate on newborns to 90-year-olds, and everywhere from the head to the toe in terms of flaps. And I did some craniofacial stuff in our clinics and fellowship, and did a lot of breast reconstruction, micro, a lot of flap surgery. So it really is just a cool field where everything else seemed to be shrinking and becoming more focused in one area. Plastic surgery still just kind of let you find the area that you love the most within it, and gave you great experience, hand surgery, facial trauma, all that stuff. So
Right.
that's how I ended up there. And I ended up
Wow.
here in South Carolina, yeah, at the medical university for a fellowship. Was fortunate enough after 2 years in training to get a job here full time. Spent 5 years in academics and then started a private practice around the same time that I finished up MBA program at the University of South Carolina. So
Oh,
yeah, so I figured I'd try to use that degree, and
yeah.
it's
So,
it's a great education, but not very practical to the real world.
right. So after 4 years of medical school, you did 5 years of general surgery, which gave you the background. How many extra years of training was it to become a plastic surgeon on top of the 5 years of general surgery?
Yeah, at that time, they were doing kind of more of the separated, where you did the full general surgery and 2 years of plastic, either two or three. I did two at my program. A lot of that's changed now. There's a lot more of 3-and-3 programs where you don't do the full general surgery training. Um, there's a lot of arguments to be made both ways.
Right.
I think
Bas-
being a chief surgeon or general chief resident in general surgery is a lot of probably where you learn 90% of your surgery stuff. So I think it's an important year, but there is a push to shorten training with obviously good reasons.
Right. And what did you do the fellowship in, the additional training?
That was just all in plastic surgery, and I spent a lot of time doing microsurgery with Bob Allen, who was kind of the pioneer of the perforator flap breast reconstruction, which is big in New York, and I know a bunch of the guys up there trained with Dr. Allen. So a lot of reconstruction early on. I started and founded a breast reconstruction program at the medical university here, and then just over time, I think a lot of us transitioned from that into more private practice settings, and now that's I do 100% cosmetic surgery.
Wow. So why would you want to move from the snow blizzards and snowstorms in Buffalo to South Carolina, where it's kind of warm all year round?
Yeah, I mean, so yesterday it was about 81 degrees and sunny and no humidity and not a cloud in the sky. So,
And I think
I
they
think
got 3 feet of snow in Buffalo
no,
already.
no, it's just the brightness of, the sun is out. But for me, I think I miss that part of the country. I think it's a great place. They're great people. But they're facing a lot of challenges economically and with growing businesses. And I think we started as a small private practice with one or two employees. We grew to almost 100 at one point. Yeah, I think it's hard to do in areas that are not growing like this. And I think, it's been a huge boost and help to be in somewhere like Charleston that wins award after award as being one of the best places in the country and the world. And so, I'm
Right,
just one of the people that are really lucky to have gotten here, gotten a job, and been kind of tied to the area now.
right. So tell us about your unique practice now in Charleston in South Carolina.
Yeah, we do a lot of breast surgery. There are a lot of implant breast augmentation, a lot of mastopexy and lifts, and I do a lot of face surgery now, a lot of eyelids, lower face, neck, facelift type things. So it's really diverse, and the people are really great. They come in with, for the most part, reasonable expectations. They don't want to be overdone. They live in a kind of conservative part of the country where they don't really want to stick out. But a lot of moms that have had one, two, three kids now they're in their late 30s and they're just trying to get back to who they were and not really be somebody else. And so those folks tend to be the most happy after the surgeries in general. They seem to get results that they're happy with. And so as their doctor and working with them, it's always a pleasure to see them happy with reasonable expectations. I think New York City, Miami, LA, there's definitely a different mix of clientele.
Right. Speaking of that, have you found there's an increased interest and increased number of cases you're doing, plastic surgery cases, during and after COVID? What was the effect of COVID on the plastic surgery market?
Yeah, COVID was scary as it was everywhere. Going into it in that spring, really didn't know what to expect, and it was scary being a business owner and having a large amount of employees and not really sure what the world was going to do. I definitely wouldn't have foreseen what it did to plastic surgery and that it really grew dramatically during that time period. South Carolina was not one of the states that was severely shut down, but we did have limitations for sure. But a lot of folks found themselves not having to go to work. They couldn't travel. They couldn't really spend money on other things. And a lot of them that had been waiting to do something, now was the time for them to do it. They had time to recover. They didn't have to miss work. They weren't really seeing people anyway. And we did all of our surgeries for the most part in our operating room with just IV sedation propofol. So we weren't using ventilators. And that whole fear of going to the hospital or where there's an emergency room or sick people,
Right.
we were able to circumvent a lot of that. So 2022 for us ended up being, really a big year, as it was for most people in the industry, I think, that lived outside of areas that were hit, like the Northeast obviously was hit much harder in different circumstance. But yeah, it was kind of unusual. It was a really scary time, and then it was a busy time, and it was dynamic. It was, if you look back, and employees were different. That whole shift that happened from working in places to working at home, and I don't know in some ways that we've ever gotten over that part of it. It's always, I don't know where all the employees went, but
Right.
it's been hard to find good employees and good help, and so it was a dramatic change that was interesting. And looking back now, I'm just I'm glad we moved past it for sure.
Yeah. Good for everybody.
Yeah.
Now, there seems to be an increased interest in plastic surgery done in younger people. Previously, it was mostly older people who are developing wrinkles and their skin is sagging and things like that. But there's an increased number of young people that I'm seeing on social media are having plastic surgery at a very young age and possibly influenced by celebrities, actresses, actors, models having plastic surgery. Do you find that?
Yeah, absolutely, for sure. It's a trend at times, and for a certain age population. I think the moms of the world who are done having children and want to get back to their pre-baby bodies is consistent and always going to be kind of doing their thing to get back to who they were. But we definitely see things from injectables like lip filler and different things from the Kylie Jenner and all those girls and all that discussion, the Kardashians, and butt enhancements with fat grafting and gluteal augmentations. We saw a shift from really kind of big full breasts that were really popular 10 12 years ago maybe, to smaller breasts where we're taking a lot of implants out and either leaving them out or taking them out and putting in smaller ones.
Hmm.
Um, but in the younger population, especially, I have four daughters, so it is crazy to see firsthand kind of the effect that whole world and social media has, and it is it can be highly useful. The dissemination of information is. I don't know that there's ever been a more powerful way to disseminate information, but it is unchecked for sure, and not always, I think, monitored for the negative, although it's becoming more of a deal with these platforms. But I mean, if you're a 12, 13, 14-year-old girl sitting at home in your room seeing pictures of all these perfect people, and you're not perfect, it has an impact, and it's so hard now to tell what's real and what's not with the filters. And what we've seen too is just a lot of people coming in, even older people, because of the phones, seeing themselves so much more. I think back to
Point.
I, yeah, when I was a young kid or a teenager, you saw pictures of yourself at a birthday party, a wedding, maybe something. But now, I mean, it's 24/7, and turn the phone on backwards, and you see your neck, and you see your eyes, and you see your wrinkles, and so we had a lot of that during COVID too, where people came in and they're like, "Oh my God, I turned on my Zoom call," and I was like, who is that? Like, where did all those wrinkles come from, and how did I get so old?" And so it's
Funny.
definitely a
Yeah.
perception.
It's funny you mention that because I usually take the bus in the morning to get to work from home, and I see people turning on the phones and just kind of looking at themselves.
Yeah, it's and yeah, I mean that we could have you could have a whole podcast series on that. It's just it is.
And
Appearance has become a fixation of this generation, or whatever generation you want to call it now, that it's crazy, and it's good and it's sad. I mean, I see some people that come in to us that want their kids that want their nose fixed or their ears fixed or their things, and it's
at
just,
what age?
yeah, I mean, they can be early teens. That's when
Really?
I think that's when we start to see it a lot. Girls come in with all their hair pulled forward and their ears will be out a little bit, and my heart breaks for them. I feel terrible. And I try to tell them, the problem isn't with you, it's the people making fun of you, but that only goes so far, and
Right.
so,
Hmm.
but a lot of parents do bring them in, and if I truly, depending on their age or the circumstance, sometimes, somebody other than your parent and somebody that you think is in a position of, power or whatever as a plastic surgeon says, you really don't need this. You look great. A lot of parents will say thank you, and that goes a long way for a while. I'm sure it comes back up as they get older, but
Right.
I don't like to do things to anyone under the age of 18 in that world. If you can't consent for yourself, you know, I don't
Right.
think we should be changing appearances at that point. I know there's some argument about 16 now and stuff in South Carolina, but um,
So if you see a 14-year-old who thinks their nose or ears are not appropriate for TikTok or Instagram, you won't do the surgery if you think they look reasonably well and don't have very unusual,
yeah,
abnormal noses or ears. Is that right?
yeah, that's right. I do see 14-year-olds with ears that I will contemplate helping and have a discussion with them about why do you want to do it? How do you think it's going to be different? Here's some of the things that can happen. And there are, like anything, there are 14-year-olds that are mature beyond their age, and there's 35-year-olds who are not. So I hate to put an
Right.
age on some of that, but noses, I've never operated on somebody's nose under the age of 18. I think that is a very highly personal, millimeters matter, perception matters. I have folks come in and say, I want somebody else's nose, and they'll point in a magazine, and I'm like, your nose is actually better than theirs. Like, it doesn't, but we're our
Right.
own worst critic.
Wow.
We're so hard on
Do
ourselves.
you see young people coming in with their phones and they'll
Yeah.
basically put up a photo on Instagram or TikTok and say, I want to look like that? Does that happen?
Yes.
It
Yeah, it's
does.
more and more now. I probably one of the more common things I get asked is, can I show you a picture? I'm like, sure. But I mean, that gets into so many things because it's not your skin, it's not your soft tissue, it's not your bone structure. There's not a lot of similarity. And so the idea that you can take something that's completely different all the way around and make it look like that. And that's why I don't use a lot of that computer generated imaging anymore either, because you can make a picture look any way you want. That's not reality of surgery or reality of how it may turn out.
Hmm,
So,
interesting.
yeah.
What's your personal favorite procedure that you do that gives you a sense, a good feeling that you've done something really good for a patient and that patients also enjoy and are thrilled with the results?
Well, I think there's a couple of them. That's a great question. I get asked a lot, and I probably change my answer every time. So if anybody actually hears it, they're gonna probably gonna be like, "Well, he gave me a different answer." But I love eyelid surgery. I think that I tell folks, if you can do one surgery that makes you look refreshed, less tired, that is the one thing, and it's an easy recovery. It's about 4 or 5 days of having sutures in, and as long as it heals well, it's just an easy, big difference that a lot of folks will then look at you and say, "You look different. Did you get a haircut? Do your hair differently? Whatever." They don't really know why that you look different. But I think
Right.
that's probably the easiest kind of one that I enjoy. That's quick, easy, low stress, heals well, not a lot of. But I think the other is the moms who've had children and are just kind of depressed about how they look, and they've lost a lot of self-confidence. They used to be 120 pounds and wore swimsuits and bathing suits and things, and now they won't go to the beach or they won't go out with their kids or the pool. And so I think
So
those
they
folks.
need to move to Buffalo or have
Yeah,
plastic
exactly.
surgery.
Yeah, that's right. uh, those folks, it's a life-changing thing not only for them, but I often tell them it's changing the lives of their kids, their spouses, their everyone around them, their friends. They're just more inclined to go out and be active and go out and enjoy themselves and just be a better mom, wife, whatever, friend. I think
Right.
I get a lot of people. It's in the book. I talk about it. Where folks come in and say, women will come in, especially, and say, I feel so selfish. I shouldn't be doing this. And I point out that you're not. only doing this for yourself, and you're actually improving your interactions and relationships with the people you love the most. So as much as it helps and gives you confidence, that carries over to your, day-to-day life, your life as a parent, as a spouse, and all of those things. So seeing some of those women come back after mommy makeovers where they just carry themselves with a different level of confidence. They even dress a little different. They just move and act differently, and it's really, I think, a great thing. When you have children, obviously you put them ahead of everything else in your life, and so to
Right.
be able to get some of that back and have yourself feel good about how you look and feel, and how just wearing clothing, that you couldn't wear for years.
So that would be breast surgery and also the tummy tuck type of surgery.
Yeah, it generally refers to just some kind of rejuvenation of the breast and abdomen. So it can be implants, implant and lift. It can be a breast reduction, just a lift and reduction type thing. And then something with the abdomen, which could be a tummy tuck or abdominoplasty or just liposuction stuff. Something basically that the two areas that are most dramatically affected by childbearing, basically addressing that.
Right. So a lot of plastic surgery is referred to as a rejuvenation, but I noticed on your website something called prejuvenation. Tell us about that.
Yeah, I think it's kind of getting into the same idea where we're just kind of trying to also, if somebody's kind of going through something in the future and we try to get them in a place that they're more comfortable and confident and go through that process a little bit quicker and easier, and really trying to increase protein intake, doing things like that that just help them to go through the process and recover quicker and hopefully get a better outcome, which can be anything from protein. Now we're doing some hormone stuff and weight control and all of these things that I think for a long time surgeons were, just kind of focused on the surgery, and that was like they looked at that point of time as all that they were kind of responsible for. And I think now we see it's all intertwined, and to get the best optimal outcomes, you have to kind of address all of that and have some knowledge in that area, and patients look to you for guidance in that. And I think that gets ultimately a better outcome and happier patients.
That's great. Now, I'm noticing, I want to talk about certain procedures that I'm noticing and they're in the media and especially social media a lot. I'm noticing a lot of actresses are getting this cat's eye look or fox eye look.
Yeah.
It seems to be everywhere. What is that, and why are people so eager to have that done?
Yeah, I think it's basically something that a lot of women would use makeup to try to emulate, and kind of have that wispy corner of their eyelids and eyeshadow makeup. But over time, with the way that the brow drops and pushes the eyebrow down, that whole area kind of begins to get squished. And so you get redundant skin over the upper eyelid, but also that lateral part kind of collapses down. And a lot of women will say their
The
eyes.
outer part of the eyelid collapses down.
Yeah, that whole area because of gravity and lack of elastin and collagen and all that stuff. And we lose volume as we age. So a lot of women will come in and say, my eye's like lost, like it's smaller, it's shrunken in. And really, it's just all that tissue kind of falling over it. So with that procedure, we're looking to really lift that corner mid half of the eyebrow and lift it up and out and almost streamline that. And a lot of times we will do an upper eyelid resection or blepharoplasty with a lateral brow lift or lateral eyebrow lift. So it's really trying to give that elongated, almost aerodynamic, I guess, look of, if you will. And
Right.
a lot of women and people, obviously think that's just a much better look than that kind of sunken where you lose that shape. And so, yeah, it's definitely a thing. We see people come in trying to do it with a little bit of Botox, where you inject Botox into the eyebrow. The eye muscle is a circle, so if you can break down some of the contracture of the lateral circle, it allows the upper muscles to pick that corner up and sort of a pseudo eyelid lift, if you will. So
Right.
between
But
makeup, Botox, and then surgery, everyone's addressing eyes.
yeah. So I'm seeing, however, young people have that. People in their 20s, late 20s, early 30s who don't have the redundant
Yeah,
sagging tissue. They're having that procedure as well, right?
right. And they just like the shape and the basically elongation of that area. But we do see people, even in their 30s, the eyelid surgery is one thing that I will tell everyone. Almost everyone can use it. If you're an adult, you probably have some redundant skin in your eyelids.
Right.
So especially women, because of the putting on the eyeshadow and doing that kind of stuff, they're noticing it a lot more. But men, because we tend to have heavier eyebrows, and I have friends that are, in their 30s that start to have a lot of skin there. But yeah, and that gets back to, like you were saying, the trends in TikTok. And so it starts out with some makeup influencers are doing their eyes that way, and then somebody has surgery or
Right.
Botox, and it just kind of goes down that path. And then, a year later, it's out of vogue, and it's something else.
Something else. Yeah, since I started doing these podcasts about
Yeah.
17 months ago, I noticed that I may need that cat eye look.
We'll hook you up if it comes to that. We'll get you
I might come down to you in
done.
South Carolina to
We
have
can
that done.
you can broadcast it as you do it.
Yeah,
Yeah,
we could do the live surgery.
yeah.
What about light therapy? There's something called broadband light therapy for skin. Can you explain that and what that does?
Yeah, there are all kinds of different light therapies that are out there now, from red light to blue light to different ones that um, the idea is that exposing the skin and inflammation process that occurs either due to sun damage, it can be from surgery, trauma, any number of those things, that kind of therapy is beginning to show effectiveness in improving the outcome of skin, scars, rejuvenation of skin. That's really where a lot of the technologies, I think the light therapies and laser techniques in therapy that are being used more and more are just pretty amazing in some of the results that they can get in their treatment of skin. And I think it's always an interesting thing, even when folks come in for surgery, because we tell them, I can do the surgery and we can remove loose skin that you have, but we have to leave skin behind, obviously. And that skin behind has been aged at whatever age you are and has been damaged. And so the outcome is really only as good as the skin that's left behind and how well we can treat that. So a lot of folks are using these lights ahead of surgery. They're using them right after, putting them under lamps and different red light therapy after surgery, before surgery, and then using lasers to kind of try to maintain that. I think as a whole, the society really has gotten better about sunblock and the importance of sunblock. I think when I was a younger teen, I mean, we were out in the sun all the time and nobody wore sunblock, and so I think that's not quite as prevalent, certainly as early as the 20s. It seems like people are really becoming aware of that. And I think we have just really better medical grade skincare that is just far more effective at anti-aging, protecting the skin, and helping the skin just age better. So I think the combination of the light therapy, lasers, and then just skincare has really made a difference. And I tell folks, if you're going to start somewhere and you don't want to spend a ton of money, medical grade skincare is not cheap, but a lot of folks are going to department stores and spending a ton on things that are not medical grade. So I think it makes sense to get good stuff, and it can have a huge impact, especially in places like where I am, and the environment is hot. The sun is hot all year round, basically.
Right. Now, we're taught for decades now that the sun is actually harmful to your skin. It causes wrinkling, it causes aging, it dries the skin out. It can even cause skin cancers of various types. So, how's this light therapy different than the sun? I assume there's no ultraviolet light in it.
Right. Yeah. It's just different wavelengths that are not harmful and that have been shown to help with inflammation and free radicals and that kind of stuff.
So
Um,
which colors are best? I've seen ads on TV for these LED masks that you wear, and some of them show red lights, some blue lights, some white lights, some have a mix. How
yeah.
does one know what works and what's best?
Well, I think you want to go with a provide. That's something I wouldn't recommend you kind of pick out on your own. I think you want to go in and be evaluated, and it really depends on what your goals are and the kind of damage that you have to your skin from whether it's sun or environmental. I think that's important, but I think that is definitely one of those things that it's just independent of how you are and what your problems, might be. And then what kind of laser therapy and stuff like that, again, is, do you have rosacea and redness? Then it's a different wavelength of if you have discoloration and darkness, if you're trying to treat wrinkles, scars, things like that. So it really is becoming, that whole area is kind of exploding into its own area of expertise for sure.
So the patient's better off going to you or plastic surgeon or maybe even a specially trained dermatologist to get
Yeah.
those treatments rather than buying something off late night TV that's advertised.
Right. I tell folks I'm not one to bash anything, and I don't want to speak negatively of anything. I think I stick to telling folks things that I know have been proven medically by studies that I can back up and say
Right.
this makes, folks will ask about scar creams. Only really silicone based or silicone based gels have been shown. Even those are not great, but they show to make some improvement. So, uh, I think that makes sense. Some lasering techniques, but to answer your question, I think unfortunately I've seen numbers that raise that can grow into the several billions and billions of dollars a year that are spent on creams and therapies and treatments and devices that are bought online in different places that unfortunately patients don't get a result from. And so unfortunately, we see a lot of them at the end of their rope, but they've spent a lot of money and a lot of false hope in that process getting there where, and I think some of that is probably perception that they're going to come in and we're going to try to push something on them or try to sell them something that's going to be way more expensive. But I tell patients all the time, my only goal is for you to be happy. So I don't want you to do something or spend money with us and be unhappy. And so the one nice thing about surgeons and plastic surgery is that we offer lasers, skincare, estheticians, we have injectables, Botox fillers, and we can do the surgery. So I don't have a preset agenda of what you should do other than hopefully what's going to meet your expectations safely and give you the best result. And so if that's, doing skincare and light therapy and lasers, great. If, you're somebody that's 70 years old and has really loose skin, I'm not going to try to use fillers to fix that. You need surgery. And if you don't want surgery, I totally get that, but don't spend your money on stuff that you're not going to get a result for. And
Work.
yeah.
Tell us about microneedling. I'm an ophthalmologist, so I see
Yeah.
patients and they tell me about their facial issues and eyelid issues. And
Yeah.
yeah, they love their blepharoplasties. I don't do that. I do cataract surgery,
Sure.
LASIK, things like that, but I refer them out to specialists in eyelid surgery. But a lot of them have this microneedling procedure of their skin and face. Can you tell us about that, how that's done, and what it
Yeah.
accomplishes?
Sure. Yeah. So microneedling, the best analogy I like to use is it's like aerating the lawn or aerating a golf course. So, it's basically punching micro holes through the skin. And it can be anywhere from half a millimeter to 4 millimeters with an aggressive treatment. And those holes then have new collagen, skin, tissue, elastin, all of these things growing through them to help regenerate that tissue. And so it's really a great treatment. It's easy. You do get kind of beat up for a day or two with some bruising and a little bit of punctated bleeding, but the results are pretty dramatic at a year. And so it's not a super expensive treatment. And it's one that we combine with peels and other things that you can do at the same time because you're punching those holes. You can put a peel on top of that, and you get a deeper amount of penetrance, and you can get a better outcome. And you can also use growth factors and other things on top of that that will help the skin and tissue. So with those treatments, you can improve acne scars, you can improve wrinkles, discoloration. But really, the main thing around the eyes is the thinning of the skin that occurs, which is what a lot of folks come to us about is complaining that they have either loose skin or they have dark circles. And those circles, a lot of times, are due to translucency through the skin and seeing the orbicularis muscle and that behind it. And so the only way to treat that really is to try to thicken that basement membrane of skin. And microneedling is a great way to do that. It can also be done with PRP, where we draw your own blood, spin it down, do the microneedling, and then apply PRP, which has been shown to get a much quicker recovery and to some degree, most likely a better outcome, but certainly less inflammation after.
PRP is platelet-rich plasma, is that correct?
Yes, sir. Yeah,
So
that's true.
you inject that while you're doing the microneedling, or is that just applied on the surface?
It can be either, but with microneedling, because of the channeling in the holes, we'll apply it on top. There are areas of the face that we inject PRP and PRF, which is the fibrinogen version of that, or fibrin version, which is a little newer and it shows a little bit more efficacy so far. But yeah, I think that a lot of that pluripotent stem cell type stuff is where a lot of the future is, especially of skin and soft tissue.
Tell us about buccal fat removal and chin enhancing procedures.
Yeah.
What do you do there, and how does that work, and what are the results like?
So a lot of social media is showing people with these almost chiseled like faces that have just loss of volume in here, but still have big cheekbones. And so that is a combination of either increasing the volume of their cheeks and bone structure, but also there's a fat pad that lives kind of right in this area where people who have chubbier cheeks, that's being removed. And it can be through a small incision on the inside of the mouth. It does make for a difference in terms of the sleekness of their lower third of their face. One downside to that is that as you do age, you naturally lose volume in our face. So a lot of folks are coming in for fillers later on in life. And in some ways down the line, removing that fat pad can make you look more gaunt or collapsed appearance or older at some point. But it's definitely an in topic right now and an in thing that goes up and down. A few years ago, it was really a hot topic. It went away for a while and it seems to be coming back a little bit. And then almost everyone wants more of a defined chin and jawline now because of the selfies. Everybody comes in and will like turn their head and be like, I want to have like I wanted this to be more. I want my when I see my nose, the proportions of the lip to chin. A lot of folks have a recessed jawline or chin, and so they have more laxity of skin under their neck, and their profile pictures and don't look proportionate. So it used to be the only way to really fix those would be with either a chin implant or a sliding genioplasty, where we kind of divide the bone and slide it forward. But now filler has become a really reasonable option. A syringe of filler or two can make a huge difference in prominence.
Wow, you're making me feel so self-conscious.
Yeah, it's an interesting field to be in as you age because you
Right,
definitely see the trends and you see what people are coming in for and
right.
the ages
But
that they're doing it at.
right, but I'm also seeing on social media this Ozempic face. People are making
Yeah,
fun of people who've had Ozempic. They also have these hollowed out cheeks. So isn't that contradictory? You're making fun of Ozempic face, yet on the other side, you're having the fat removed from your cheeks, which kind of gives you an Ozempic face.
yeah, I completely agree with you. Ozempic face and Ozempic weight loss body changes are interesting because they've been named after this drug that's causing weight loss, but in reality, it's not because it was Ozempic. It's because of the weight loss rapidly happening. So somebody has gastric bypass surgery or gastric stapling and they're dropping 10, 20 pounds a month initially, they're going to have that as well. So it's not that the body really does something different because it's Ozempic. It does that because of the calorie deficit and the weight loss that you have. And so they're getting loose skin. People who become big runners, you see that in, who lose a lot of fat, subcutaneous fat, and their skin just hangs because they don't have that volume anymore. So that's really what you're seeing in those folks, and it's been attributed to Ozempic because that is definitely where you're seeing this 20 to 30 pound quick weight loss with patients. But it's really the same end result of any quick weight loss that you would have, and that's where we're seeing fillers and those things being used to try to revolumize the face. Uh, a really thin, droopy face looks like an aged face, whereas a really round, full face looks more youthful. So that's definitely where the stuff's going this right now with fillers and facial rejuvenation.
I guess it depends on your perspective and what you think is
Yeah.
ideal. Some people like that sunken face look, and other
Yeah.
people don't. I'm seeing some people though who've had their cheeks overdone with the fillers, the
Yeah.
cheeks
Yeah.
sticking out too far. How do
Yeah.
you deal with patients who tell you, I want more? Can you put more filler in? And they start looking a little bit strange, shall we say?
Right. I think it's with filler and with surgery, we see that where folks, I don't, I don't know exactly what happens mentally with that because I think they started out seeing themselves one way, and as they got better and better, they felt better, but then they became more critical almost, and so it kind of propagates. Or like anything, a little bit is good, a lot they think is going to be better, or they begin chasing a structure or appearance that's not achievable for them. So, there's some people that just have different, obviously, have much different bone structure, different skin, different, soft tissue. So they're not going to be able to get that result necessarily. And at some point, it goes too far. But the good thing with filler now is that most of them can be dissolved pretty easily with hyaluronidase and an enzyme. So we do see folks come in who have been overdone, and a lot of times the only way to fix that is to dissolve what's in there and start out again from scratch slowly.
Right. So you're injecting this enzyme to get rid of the filler.
Yeah, right. Yep,
How do
hyaluronidase.
you deal with patients who have this desire to do too much? How do you put the brakes on it?
Well, the first and most important is obviously safety. So if something's just getting to the point where it's not safe, that's our number one, obviously, responsibility. It's a hard question. It's one of my best friends makes boats, is a big boat maker of one of the big brands. And it's funny, we always talk about like the perception of what people think is good looking, even in the world of whether it's product, advertising or product development or something like the field that, I'm in. It is that old saying, beauty's in the eye of the beholder. So it's a tough line to walk because there are people that do things that I would never in a million years say they should. I wouldn't recommend. But I tell people a lot too. I joke. I'm not your priest. I'm not here to judge. I'm not here to tell you like. I'm here to tell you your options to try to figure out what your goals are and what we can do to hopefully meet those goals in the safest way possible. And if any of those things don't align, then that's my definite responsibility to tell you. But it's hard for me to tell people how they should look or what look is going to make them happy because I don't have the authority nor really the knowledge to know what's going to make them happy. So we try to stay in those lanes of what's safe and reasonable, but also I do, I am there to listen to the patient. I tell them that because a lot of them will come in and say, well, you're the doctor or plastic surgeon. You tell me what you need. And I'm like, no, that's not how this works. Like
Right.
I can, I can help, but I always tell, I could tell somebody five things that they could do to make, or that I think they should do, but they may not be five things they even notice. And it'll be the sixth one that drives them crazy. And I may not even see that as a problem. So, we know folks are just their hardest, worst critic. And so a lot of this end of surgery is listening.
Right. You just have to listen. So
Yeah.
part of your practice is psychiatry. In
A
addition,
probably pretty large part of my practice is probably psychiatry on certain days.
right,
Yeah.
you have to listen to the patient and
Yeah.
figure out what they need. What about cool sculpting? Again, I see lots of ads on TV for that. Does
Yeah.
cool sculpting work to get rid of belly fat? Can you avoid a tummy tuck if you do enough cool sculpting?
Right. That's probably the best advertised medical device in the history of medicine. It is, has its own. I mean, everybody, medical or not, knows that term, cool sculpting. So it works very well in the right patient population, and for patients who are in otherwise really good shape, don't have a lot of excess subcutaneous fat, but have pockets or areas that they want to treat, then it works very well. And so the practices and the doctors who do astronomical numbers of cool sculpting, a lot of them are like in La Jolla or Orange County or places where they're 10 million people, and they're all fitness fanatics for the most part, and they just have an area that they can't address. Um, but for most people who come in and have a generalized lipodystrophy or fat around their abdomen, their love handles, those areas, it's really not a reasonable option. It's spot treating for the most part. You can do, 6 or 8 areas, but most of them have to be treated 2 to 3 times. And it's expensive by the time you get to what you would have spent to have liposuction, where the fat's in the canister, you've seen a dramatic difference and you can do a much larger area. Most folks are better off having done that. The other thing is it doesn't do a lot to tighten skin at all. So it can empty the fat again, like we were talking about with weight loss, but it's not helping the skin tighten. So in the right person, in the right kind of candidate, it's a great option. It definitely destroys fat cells. And the way it works is basically it takes tissue and pulls it into an apparatus or handpiece, and it drops the temperature to near freezing, so much so that the skin is better vascularized and able to withstand cold better than fat. So the fat below the skin dies basically, or is injured, and your body basically gets rid of it through some apoptotic cellular death and stuff like that in lysis of the cells. And your skin has enough resiliency to not be damaged. So
Hmm.
but the skin itself is not really tightening much. So it's still a popular treatment. We have 2 of the machines. We do still treat people, but it's probably been a better advertising device because folks come in for it, and a lot of them are not ideal candidates for it, but they get a much better treatment with liposuction or
Right.
tummy tuck.
Right. I've seen some articles, a few celebrities actually claim it damaged their bodies, cool
Yeah.
sculpting. Is that a risk, and is it a significant risk?
Yes, it's a very, very low risk, but there are definitely a real sampling of patients, and we don't really know why that they have this, rather than the inflammation and kind of death of the cells and the removal of the fat. The body actually undergoes like a hyperplastic response and kind of a fibrotic thickening
Hmm.
process where they actually end up with more fullness in that area. It can be very firm, it can be uneven, and basically, the only way to really treat that is with an aggressive liposuction or thermal lipo, where we go in with lasers and/or canister cannulas and break that up. But yeah, it's a real thing. It does happen. Extremely rare for the number of treatments that it happens in, but it's real.
Right. Every surgery procedure has some risk.
That I spend all day trying to get that through folks' heads, that I tell people there are no zeros or 100% in this business that we do, and it's hard because I think part of human survival is you don't think anything's going to happen to you, right? Like you get on, I know you go out and drive on highways and you do things, and you get in airplanes and you do things and don't think about the one less than 1% or whatever where something happens, but it does happen to somebody, and it is
Right.
100% when it happens to you. And I have so many, times I've tried to talk with people who've either had a complication or they've had a complication somewhere else and they're coming to be fixed or whatever, and they're just so like, why did this happen? I can't believe this happened to me. I'm like, I don't. If you every procedure has world literature complication rates done by everybody everywhere across the world. There's and revision rates and things like that are pretty high in some of these with scarring and stuff, and so everybody wants to blame the doctor. They want to blame something, the nurse, somebody, but it's hard. I mean, I think, we could spend days talking about informed consent and trying to get people to understand, and, not, there's nothing that we can do that's 100% effective and accurate.
Right. It's the same when I do eye surgery.
Yeah, right.
The
There's just
risk
nobody,
is
there's no, not a specialty or a procedure out there that's not that.
right. Exactly. Now, I'm noticing in again in the media online that there's these experts who are appearing who claim they can tell what kind of plastic surgery procedures certain celebrities have had. It's become like there are TV
Yeah.
shows about that now. Can you tell by looking at a celebrity or a person what they've had done, or is that just kind of educated guesswork?
Well, in full disclosure, I've definitely done that before. I've been asked that, and I've I've been quoted, I believe, in a few different websites and articles. You
Okay.
know, yeah, I mean, you can look at before and after pictures over time and see to some degree what folks have had. I always feel bad. I always feel a little bad in even commenting on these folks. I mean, I guess they choose to be famous to some degree, but
Right.
um, I think it's got to be hard in that business, right? Like that's your whole livelihood is, you look at Brad Pitt and these guys that are trying to reverse age basically in some degree. And I mean, that's their whole livelihood and that's who they are and how they're known and who they're known to be. But you can definitely see celebrities. And the thing, celebrities have a couple advantages. They have obviously usually excess of resources so they can do stuff over and over again and the best stuff. And they have periods of time where they don't necessarily see people or aren't being seen in the public, so they choose not to go out for a few months or weeks or whatever. So I think they're able to get a lot of stuff done under the radar, so to speak. But I mean, there are definitely pictures where some of them go overboard and they come back. And I think if you look at pictures of teenage Kardashians and 30-year-old Kardashians, you don't need to be a plastic surgeon to figure out that something probably a little non-natural has happened in that process. But uh,
Right.
it's
Hmm.
to some
Interesting.
degree. But when I do it, and I have done it a few times, and I speak in generalities. Like you see somebody's skin or their jawline, they could have had liposuction, they could have had filler, they could have had a facelift. There's a lot of things that they could have had, and I
Right.
don't. Sometimes I don't know. Some of these celebrities will deny it till the end. But and I don't really know why, because there's pictures of them that anyone could tell. If you see, I mean, bathing suit pictures where clearly they've changed their body, and
Right.
uh,
Hmm.
it brings up an interesting point in that it's still taboo. It's interesting that I always tell folks like nobody goes in the store and is like, I want to buy the worst looking outfit on me. Like, what's the ugliest clothing I can get, or I want to drive the ugliest car, or I want the worst haircut. But for some reason, wanting to feel good about how you look is perceived as a problem and as some weird way, especially with men, especially with, certainly as women age. And it's kind of unfortunate because I think, again, if it's safe and you're reasonable in your expectations, I don't know why it should matter to anyone else or why you'd unfortunately be concerned about anyone knowing. So,
Right. That's a very interesting observation, right? Everybody wants this, but they don't want anybody to know that they want it or did it. Reminds me of a story a few years back. One of my plastic surgery colleagues did a blepharoplasty on a celebrity, and the one of the eyes had a complication
mhm.
from that. So the plastic surgeon called me and said, "Can you take a look at so and so's eye? There's some kind of problem." I said, "Sure, just have him come over to my office." He says, "Well, can't come to your office. Can you make a house call because he doesn't want to come out and let people in his building see that he's had surgery?" So I go, "Well, okay, I'll do it because we need to check the eye out and make sure there are no problems." He said, "Oh, one more thing. He wants you to go into the building without wearing a white jacket and don't bring anything that looks like a doctor's bag." Okay. And he says, "One final request. Can you please take the freight elevator in the
Oh my
building,
God.
not the regular elevator?" Well, the
uh,
story turned out good because it was just a subconjunctival hemorrhage that went
yeah.
away after 2 weeks. Fortunately, there were no problems, but it was interesting how this celebrity was making sure that nobody but me and his plastic surgeon
Yeah.
knew that he had a procedure done.
Yeah, it's kind of, I mean, it is, not only for the celebrities, but just even average everyday people. Like I was saying, they're, moms and grandmas and people who've worked their whole life and done everything for everyone around them. And they want to feel good and confident for no one other than themselves. And they still have to worry about that, and there's definitely a fair share of patients who just say, I don't care what anybody thinks. I don't, heck with them and it doesn't matter. But it is kind of sad that it's still like that. And I always say, like what I said before, I mean, nobody purposefully wants to look bad. So with any other, it's okay to do anything else in your life. Like you can buy you're applauded for buying a nicer car or nicer clothes or a fancy haircut or coloring that people do or nails or whatever. And and for some reason this is different. And I don't know. I
Interesting.
think it's getting better, but it's still a long way to go.
Right. Now, you've written a couple of books about plastic surgery for the public. One is called Finding the New You, and the other one is Finding Beauty. Can you tell us about those books and why you wrote them?
Sure. Yeah, I'm still kind of, I guess, old fashioned. I like paper and books and like holding things to read and stuff. But um, I was listening to a podcast by a gentleman who was talking about lines on products and how they're designed, and even as much as where they sit on a shelf in stores and how they all the psychiatry and psychology of product sales and design and lights and how the light hits lines and stuff. And I was listening to this, and it actually made me really start thinking about cosmetic plastic surgery and how much of what we do is lighting and reflections and lines. And but also he spoke deeply about how the perception of what is beautiful changes dramatically among people, and it changes dramatically with different settings. And so I really was intrigued by that because I think, people want to look better to feel better about themselves, but that appearance is only part of that picture. And so beauty, that feeling of confidence that comes from inside, is obviously what's way more important and what is carried on with time. And so, I talked a little bit in the book about there was a good example that he had used that I referenced, where a little girl had drawn a picture. It was just a stick figure, not a great picture. He holds up the picture in this talk and he says, is this beautiful? And of course, people are like, oh, it's cute. But nobody's really taken back by it. And then he said, well, what if I told you this picture was drawn by a 9-year-old the day she passed away from cancer? And then people are like, wow, like that now, like this is a beautiful thing. And it's the exact same physical structure spun a different way. And so I think a lot of what we do is that way in terms of what we do with surgery and cosmetic surgery. And so the books basically cover, each chapter is kind of a, a made up patient, but one that represents numerous patients I had with a similar scenario. And like I was saying earlier, one of them was, I shouldn't be here. I'm so embarrassed. I feel guilty. I shouldn't be spending money here. So, I talk a lot about that. The other really popular one is women will come in with their significant other and they'll say, well, she doesn't need this. She's perfect the way she is. I don't know why she wants this. Like it, and I had a psychology friend who, when I was writing the book, I was talking about this with him, and he goes, "Well, men think everything's about them." He's like, they don't understand that somebody might actually be doing something that has nothing to do with them, and so that's what it was. Though women like honestly wanted to wear a bathing suit again and go out to the pool, not to be the center of attraction, but just to fit in a bathing suit like a normal person, or to be able to put on eye makeup and not have their eyelids hanging over their eyelash or whatever. So it really, each chapter kind of covers that type of situation. And it talks a lot about just what people should think about, what their families should, that's the other thing, family members being on board when they do these things, because it's an undertaking for everyone. It's, the whole thing about online and what you're reading online, and how reliable that is, because everybody comes in, the dreaded statement, I did my research, and I'm just like, oh my God, I don't like, and it turns out to be their aunt, who I joke in the book is like a florist, telling them this is what they need to do. And I'm like, God, like no other industry do you deal with that really. It's like, I don't go to the, mechanic and tell him I know how to, what brake shoes he should use on my car or something. But, it's just different. I think a lot of it is everybody has a body, a human body has a human body, so they feel as an expert. And people will always say, I know how I heal, I know my body. This is like, but as series are based on thousands of patients, tens of thousands, if not. So, and it's pretty reproducible.
Right. So it's a good idea for people to read your books before they have plastic surgery.
Right, that's the purpose of it, and it's not a sales thing. It doesn't promote me or my practice at all. It's actually pretty generic, but it's just interactions that I've had, and I've had a lot of patients who've read it said that it really made them think. And also the thing really useful is after surgery. Everybody comes in the first day, like, or first week follow up. Is this how it's going to be? And I'm like, we talked about this for, initial consult. You had a pre-op visit. I talked to you in the, in pre-op holding before surgery. We've talked about this for weeks, that it would take 9 to 12 months. And they'll all show up the first week and be like, yeah, I know, I remember that, but is this how it's going to be? I'm like, I don't, well, no, like, I don't, and so I don't know what else to do to try
Right.
to remind people, but they always think it's
Hmm.
different because now it's them. And, if a wound opens a little bit, even though we talked about it and I went over it and told them how well, is it, why did this happen? I'm like, well, it's part of the process,
Right. Should
so,
make your books required reading.
yeah. I've started to do that a little bit, or at least encouraging them to read it, because it really does cut down on post-operative, even phone calls and a lot of that stuff. And I've had a few of them tell me, like, I was going to call you, but I read your book and I knew that this was okay. Like, good,
So
that's a start.
that's awesome. So I'm booking a flight to your office because
Let's do it.
I want you to make me look like George Clooney. I'm,
Let's do it. We'll get your rating through the roof. You'll be the hot topic there.
I'm going to put Joe Rogan out of business, I
There
think.
you go. Let's do
on-
it.
Once you're done with me. So in South Carolina now, people know where to go to get plastic surgery. But how do people in other parts of the country, in Oregon, California,
Yeah,
Maine, how do you know if a plastic surgeon is good and will do what you want them to and
right.
get good results? How do people figure that out?
Well, I think that the textbook answer is always, board certified folks who at least have been through the process and trained in a setting that, they have experience in not only doing the procedure but dealing with complications. I think that's probably what the biggest red flag I would say is, you don't want to go to somebody who tells you I have 5,000 five-star reviews and I've never had an unhappy patient. Either you're not doing surgery enough, or you have no experience, or you're lying. And it's
Right.
so I think it's way more important to talk with the person and understand, if something happens, like, what does that look like? Who pays for it? How is it priced? How does this, because it is cash-based stuff for us. So, if such and such a thing happens, how will it be handled? Um, what can I expect from that process in the long run? Will I still get, because most of the time, even with a complication, you're still going to get the final outcome. It may be a little bit slower and it may take a little more time, but you still get that outcome. Um, I think you have to feel good about the person you're talking to. I mean, I think credentialing and that is important, but you have to generally feel good. You have to feel like it's somebody that you can talk to, if you have to at some point. And I think you can usually tell that from interacting with people. I think, but I definitely caution people about the guy that tells you that he's the best and everyone else is terrible and I'm the person you need. Like, people probably shouldn't have to be telling you that if they're that good. There should be enough of a track record, and so I think that's important. And then in our world, a lot of board certified, like, and other specialties, obstetrics, things like that, are doing liposuction and they're saying they're board certified, but they're not board certified in what, you want them board certified in what you're doing.
Right.
I could say, I do eyelid surgery, but I certainly shouldn't, I don't know how to even begin doing cataract surgery or any of that. So
Right.
I don't know how to deliver a child anymore. I mean, I'd be the last person you want doing that. But
Right.
and one way to know that is to ask if they have hospital privileges to do the procedure you're having, because it's a lot different. A lot of everything I do is in an ambulatory surgery center that we have, or outpatient, but I still, could go to a hospital and do tummy tucks, breast reduction, breast augmentation, all of that. If you're not board certified and part of the American Board of Medical Specialists, you can't, as a cosmetics obstetrician, go do liposuction in a hospital. So I think that's
Mm.
one good way, even if they don't operate at a hospital, but do you have privileges and do you do this procedure in the hospital if you had to?
That's an excellent point because if the hospital approved you to do that procedure, then
Yep.
you have the appropriate credentials. Otherwise, they wouldn't approve you.
Right. You have the appropriate
Excellent.
credentials, insurance, you've been certified, all that stuff, or otherwise they would not. So I think that's really the big thing. But, I think it's really a connection that you have with somebody. I think you want somebody that fits your personality. there are definitely patients that are better suited for colleagues of mine because of their type of personality who, I think you just get along with certain people differently. And I think it's going to be like a short-term marriage there for a good number of weeks or months. So, there has to be that open dialogue and open communication, and there has to be trust. And the thing we see a lot too is, somebody will go to an emergency room, which is the always, no offense, but always the worst thing for like a cosmetic patient because they do $1 million workup. They bill by complexity of visits, so everybody's septic and everybody has with their generalized wound openings and things that are just. And so then they'll come back in and they'll say, well, this doctor told me this and that hospital and this and that, and I'm like, but you trusted us to do your surgery. And now you're going to somebody who doesn't do the surgery, who has not the ability to do the surgery, telling you what should be done. And it's so, I think it's hard, but you just have to take a deep breath sometimes. And if you need an opinion, then go to somebody, a second opinion, who's qualified.
Right.
And again, most times you're going to get a little bit of a slant from a colleague or competitor, but at least they're, competent to handle the problem.
Right. Interesting. I saw a patient today, it reminds me, who told me that they went to their primary care doctor last week. And the doctor said, look, I only have time for one more question for 1 minute, and that's it.
Oh my God.
And the patient was very upset about that.
Oh,
Said,
yeah,
wow,
rightfully
really? Your
so.
doctor said that? Time to get
Yeah.
an AI robot as your next doctor. So
Yeah,
yeah,
I've heard
that's
it's bad. I've heard some things that we had a patient that we started doing hormone therapy through an agency to help our patients, a company, and I thought all the obstetricians and GYNs were doing that. And I asked one of the patients, well, what'd your obstetrician say? And she said, he looked at me and said, you're old. What do you expect? I said, okay, I guess that's all.
right. Time to move on. Yeah, so it's critical to have a good relationship
Yeah,
with you and the surgeon. If you don't sense that right from the start, then move
right.
on to somebody else.
Yeah, and I
Excellent.
and I think in that whole thing about somebody that's just reasonable, like there are complications, ask about that stuff.
Right.
What's the revision rate in this surgery? It can be 20-30% for scars and stuff. So when it comes up, I think the more as a physician or surgeon that we do up front to prepare the situation, the better it is than, kind of after the fact.
Right. Well, I've certainly learned a lot from this talk with you. I really appreciate your taking the time to do this. I'm sure the audience will love this because it really prepares them well for having the plastic surgery, and they shouldn't be embarrassed about it or have second thoughts that they should hide it or anything like that. So I really want to thank you for the time and for sharing your knowledge and experience and background with us.
Well, thank you. I really enjoyed it, and it's definitely been a great experience for me as well. And if there's anything I can do, please let me know.
All right, thanks.
Thank you.